Hi, my name's Andrew. I'm a pharmacy student. I'll be a pharmacist in a few weeks. I understand you have some questions for a project that you need to do?
Yep, so our medication class is organic nitrates, specifically isosorbide mononitrate.
Okay.
So, first question is, what are the specific indications of this medication?
Well, that's actually a really easy question. There's only one indication for this medication. It's called angina pectoris, which is just chest pain. So that's the only indication right now.
Okay. Are there any special considerations that should be taken into account before prescribing this medication?
Yeah, there are actually quite a few things. You definitely want to consider what other medications the patient's taking. For example, a lot of the ED medications such as Viagra or Levitra or Cialis, you would never want to take a nitrate with those medications because it can cause an extremely unsafe drop in blood pressure. And maybe the other thing you would want to consider is if they've ever had a history of hypotension or a history of falls, because these medications can decrease your blood pressure.
Okay. Are there any contraindications or risks associated with taking this med?
Well, yeah, that kind of comes back to the previous question.
Yeah.
The only known contraindication that I'm aware of is the concomitant use of one of those ED meds like Cialis or Viagra.
Okay.
That's all I can think of.
All right. Are there any baseline labs, vitals, or other information that need to be obtained prior to starting this medication?
No baseline laboratory levels, but you should probably get a baseline blood pressure and heart rate before you would start someone on a long-term nitrate like the isosorbide mononitrate.
All right. What about while you're on the medication? Are there any follow-up labs, vitals, other information that should be monitored?
No, not really, actually. This is a rather safe medication. It's been around since the 1800s, actually.
All right. What are the most common side effects?
Oh, that's a good question. So definitely the most common side effects would be something like headache. If you think about it, these nitrates, they dilate your blood vessels, and people who have migraines, it's because of those dilated blood vessels. So headache is one of the most common side effects. And then an increased heart rate, tachycardia, is pretty common because you're dilating your blood vessels, so your heart tries to compensate and your heart rate increases. Another side effect that people experience, I know you said we were talking about the isosorbide mononitrate, but the nitroglycerin sublingual tablets that people put under the tongue, sometimes they say it tingles a little bit.
Yeah.
Other than that, those are really the important side effects that you would want to be aware of.
All right. Are there any? Is there any specific time of day that this medication should be taken?
Yeah, that's a really good question. So this medication, the isosorbide mononitrate, we say it's a 24-hour medication, so usually you only take it once a day. However, I have seen it written twice a day. So normally you take it in the morning around 8 a.m. If you were going to do it twice a day, you would do it at 8 a.m. and 3 p.m. because you want to have at least a 12-hour nitrate-free period so tolerance doesn't develop. However, another thing, if you do take it once a day, a lot of times people say, you would take it in the morning. However, you should really take it before you're going to do some strenuous activity, because that's how it works best. It helps people with, chronic heart pain do activities that they otherwise normally wouldn't be able to do. But usually right in the morning, 8 a.m. would definitely be the most common.
Sounds good. So you basically answered my next question, how many times a day can it be taken?
Oh, okay. Yep. Yeah, isosorbide mononitrate, usually once a day, but twice a day. I have seen it 3 times a day, called the doctor, told him, you should really never do it more than 3 times twice a day, because it'll just lose its effect.
Are there any dietary considerations for a patient on organic nitrates?
Luckily, no, not that I'm aware of. Nothing you have to worry about diet-wise.
What about medication interactions?
Yep. Like I said, the only one that I'm aware of that's really serious would be the interaction between the ED meds. However, you would definitely want to consider, I'm sure it would flag for interactions with other hypertensive medications, because you wouldn't want any unsafe drop in blood pressure where someone would fall or hurt themselves.
Do all medications in the class of organic nitrates have similar action, side effects, and considerations, or are there certain ones that have any unique effects?
Yeah, that's a really good question, because there are a lot of different formulations for the organic nitrates. There's topical, IV, there's the sublingual, there's the patch. So the main difference between all of these is the onset and the duration of action. So those little tablets that you put under the tongue, the sublingual tablets, those are really fast onset, whereas like the isosorbide mononitrate that we're talking about is, longer on, or it takes longer to have its effect, but it lasts longer too. That's really the main difference between all of them. Something like the patch, you would tell people to rotate sites, stuff like that. An interesting thing about the patch actually is, so nitroglycerin is used, like, it's been around for a long time, and it's used in explosives like dynamite. That's what TNT is, trinitrotoluene. That's not the same thing as this. But so what you actually have to know is that if someone's wearing one of the nitroglycerin patches, if you were to give them a shock, like one of those EMT people, if you were to shock them, you should actually remove the patch, because there have been case reports where the patch actually catches fire, and it can actually burn them. So if you were an EMT and going to shock someone, I usually, you should remove the patch. But
good to know.
Yeah, definitely.
All right, last question. If you were a nurse and were going to be given an organic nitrate to a patient, what are the top 3 most important things that you would tell the patient?
Wow, that's an excellent question. So I think probably the 3 most important things I would say is that the onset is really quick for that sublingual one, and you want to take it right away when you feel chest pain. I know we're talking about the isosorbide mononitrate, but this is really important to know. So those sublingual tablets that people put under their tongue, it's going to be fast, and you want to take it right when you feel the chest pain. And you're going to see on the bottles a lot of times it'll say, may repeat in 5 minutes, up to 3 times. If no relief, call 911. The ACA guidelines actually say that you should call 911 if you don't get relief after that first tablet. So you're still going to see a lot of prescriptions that say call 911 after 3, but the guidelines say you should really call after that first tablet if no relief, just because there's increased risk of mortality. You can take those 2 other tablets, but I would still call 911. The second thing that I would say is those bottles. Again, I know that's not the mononitrate, but those bottles, those glass bottles that patients receive those sublingual nitroglycerin tablets in, you want to make sure patients get a new one every 12 months, and they store them in that bottle and keep it closed, tightly closed, because those things are very sensitive to moisture. They really lose their efficacy after they've been exposed to moisture. And then I think another really important thing is the headache. A lot of times people will get a headache from this medication, but tolerance does develop to that headache. Like for the long-acting one, like isosorbide mononitrate, what's going to happen is the patient's going to start the drug, they're going to get a really bad headache, and then they're going to say, oh, I'm not taking this, this is awful. You got to let them know that, you probably will get a headache that first time you take it, but it'll go away eventually. Just an interesting side story. The reason why we know about headaches is because the people who used to work on explosives in the factories, what would happen is they'd come in on Monday morning and they would get a terrible headache. And then by the time Friday rolled around, their headaches went away. And it was kind of really weird. And what happened is, because they developed tolerance over the week, then when they went home on the weekend, they weren't exposed to all those nitrates in the air. Then they came back on Monday and they would get that headache again because they weren't around nitrates for about 48 hours. So that's kind of interesting.
That is interesting.
Yeah.
All right. I think that's it. Thank you so much.
Oh, you're very welcome. Thank you for having me.